I made the nurse at my hysterectomy pre-op appointment feel stupid. Last month, I had to go in for my pre-surgery appointment at the hospital. I'm 34 and getting a hysterectomy because I have endometriosis that's been making my life hell for years. The pain got so bad I couldn't work some days, and every treatment we tried just made things worse. I walked into the pre-op clinic and this nurse named Karen called me back. She looked maybe 50-something with that fake sympathetic smile that healthcare workers use when they think they know your whole story just by looking at your chart. She sat me down and started going through the standard questions: height, weight, medications, allergies, normal stuff. But then she got to the surgery details and her whole attitude changed. "So honey," she said in this overly sweet voice, "I see you're having a hysterectomy. That must be so scary for someone so young. How many children do you have?" I told her I don't have any kids. Her face immediately shifted to this pitying expression like someone had just told her my dog died. "Oh sweetie, I'm so sorry. Is this because of cancer? That must be devastating to lose your chance at motherhood so young." I explained that it wasn't cancer, just endometriosis, and that I actually chose not to have kids. She looked confused for a second, then got this weird knowing look. "Well, you might change your mind someday. A lot of women think they don't want children until they meet the right man. Maybe you should consider keeping your ovaries so you could do surrogacy later." That's when I started getting annoyed. I told her I was married and had been with my husband for 8 years. We both decided we didn't want kids long before my endometriosis got bad. Karen just nodded like she didn't believe me. "Trust me, honey. I've been doing this for 20 years. I've seen plenty of women your age who think they know what they want. Your husband might want biological children someday." She kept going, talking about how I was so young to make such a permanent decision and how maternal instincts kick in eventually. She even suggested I talk to a counselor about my fear of motherhood. Finally, I'd had enough. I looked her straight in the eye and said, "Karen, I have a PhD in reproductive biology. I've spent the last 6 years researching fertility and pregnancy. I literally teach medical students about the female reproductive system. I think I understand exactly what this surgery means." Her face went completely white. She started stammering and looking back at my chart like she'd missed something important. "Also," I continued, "my husband is a pediatric oncologist who spends his days watching children suffer and die from cancer. We both decided we'd rather help kids who already exist than create new ones. We volunteer at the children's hospital every weekend." Karen was now looking at her clipboard like it contained the secrets of the universe. I wasn't done though. "And just so we're clear, my ovaries are staying. The surgery is only removing my uterus, which you'd know if you'd actually read my chart instead of making assumptions about my life choices." She mumbled something about just trying to make sure I was fully informed. I told her that her job was to check my medical history and prep me for surgery, not give me life advice based on stereotypes about women my age. The rest of the appointment was awkwardly quiet. She took my blood pressure 3 times because she kept messing up the cuff. When she tried to find a vein for blood work, her hands were shaking so bad she had to call in another nurse. As I was leaving, Karen stopped me and actually apologized. She said she'd never had a patient correct her like that and realized she'd been making assumptions about women for years. I told her that maybe next time she should ask questions instead of lecturing patients about their personal decisions. The surgery went great, by the way. My endometriosis pain is completely gone, and my husband and I are planning a trip to Europe with all the money we're not spending on diapers. 2 months later, I got a thank you card from Karen saying she'd started treating her patients differently after our conversation. Apparently, she'd been making other women feel bad about their choices for years without realizing it. The best part? She enrolled in continuing education classes to learn more about patient communication. Turns out sometimes making someone feel stupid can actually make them smarter.